We have some guests. We have Dr. Valverde with the Patient Navigator Training Collaborative and Andrea with Children's Hospital Colorado Government Affairs team, and they're going to be conducting a listening session for learning about sustainability with patient navigation. And I'll let them go from here and kind of introduce what they're planning to do. And then depending on the number of people, we'll go into breakout sessions later on. All right, so Dr. Valverde and Andrea, the floor is yours.
Great. Hello, everyone. It's great to be here with you all. I'm just here really to support Andrea. And I do want to say we call it a listening session, but we want to listen to you all rather than you listen to us. So we are hoping to have a great deal of participation. Andrea?
Yeah, my name's Andrea Stojsavljevic. I work at Children's Hospital Colorado on their government affairs team, meaning that I help advocate on different local, state, and federal policy changes as it relates to our providers, our patients and families, what's going to help them live their healthiest life at the end of the day. As Patty already mentioned, going to lay some groundwork in terms of where we're at, what we're thinking in terms of community health workers, then really meant to be a dialogue with you all. If you have availability to take your or put your video on or come off mute, would love to hear from you all. But yeah, going to talk for a little bit, and then pending if more folks join, maybe breakout groups would work better. But otherwise, yeah. So at Children's Hospital over the last year or so, with the help of Patty and Andy, we've been convening a policy work group to think through sustainability when it comes to the community health worker workforce. And when I use the term community health worker, I mean it as an umbrella term for different public health frontline workers, including folks who go by names like health navigators, patient navigators, promotoras. And so at this point in time, using it as an umbrella term for everybody in terms of moving forward with this conversation. But been thinking through long-term sustainability when it comes to this workforce. We've heard a lot of feedback from folks that, grants are available, and we are grateful that grants are available, but obviously those are short-term, time limited, and oftentimes they don't have the capacity or the financial ability to keep CHWs on their staffs, even though we know the health impacts that CHWs have on our patients and families day in and day out, whether that be with health education, advocacy, or addressing different social determinants of health they might need, like food security or housing security, really the bevy of benefits that we see from CHWs day in and day out. And so in thinking through that long-term sustainability piece, in the conversation over the last year or so, we've landed on a tangible next step of seeking Medicaid reimbursement for some of the services that community health workers provide. With the caveat that, one, we know it's not the end all be all when we think through sustainability. It's just one tangible step that we have, and other states like California and Rhode Island, Minnesota have pursued what's known as a state plan amendment, and adding reimbursable services that CHWs provide. And so in thinking through that, we have a bill title pulled for next legislative session to really set up or tee up the process for our state Medicaid department to hold a public stakeholder process and to think through the nitty-gritty details of what has to be included in a state plan amendment. And so reason for the listening session is obviously want to continue to hear from the folks who do the work day in and day out about your experience and perspective on this proposal. When we dig into the details of the proposal, it's really around what services, covered or non-covered services are we referring to? What are the minimum qualifications that community health workers have to meet in order to turn Medicaid billing on? That's typically through a certification pathways, how other states have set it up. And then 3, the reimbursement methodology. And so that's what we're working towards, certainly still seeking input, guidance, feedback from a bevy of different folks and consumer advocates, folks along the healthcare delivery system, community-based organizations. And so I'm going to take a step back. Patty, is there anything else you would add before opening it up?
No, that was great.
Okay. And I know we have a decently large group. If folks are comfortable staying in one group, I'm happy to. If it's easier to break up, happy to do that as well. I think in starting, for my own edification of who's here today, I think even just starting with, who you are, what your role is, who you work with, and a little bit about your experience and maybe any gut reaction you might have in terms of what that Medicaid reimbursement policy might entail. And we can dig into some of the finer points and details as the conversation evolves.
So everyone is welcome to come off mute to introduce or put in the chat as well, but would love to hear everyone who's on the call today.
Well, I'm Amanda Heibolt. I'm a family nurse practitioner out at Keefe Memorial Hospital in Cheyenne Wells, Colorado. I'll be honest, I don't take a super active role in Medicaid reimbursement at this point. All of our billing is done through other staff within the organization. So obviously it's extremely important that we get that reimbursement to keep our hospital going. So I'm very open to ideas and moving forward and getting more information on how we can continue to work on the reimbursement.
Yeah, thank you, Amanda. And I'll just chime in and add that although Medicaid might be step one, I think thinking through, the private payer side as well, and moving forward, how do we intertangle different funding streams, and Medicaid just being one of them at this point in time. But open to, if you all don't bill Medicaid directly, maybe your roles and experience and how it lends itself to something like this.
So it looks like Donna Hunt said she works in Rocky Ford and Los Animas for Valleywide, and their billing is done in the billing department in Alamosa. But good to have the information. So, and actually, Andrea, since this group is specifically works on cancer screening navigation, perhaps you can describe how the Medicaid, if Medicaid reimburses for community health worker, again, as an umbrella term, to cover services, would the work that they do potentially be covered?
Yeah, they would potentially definitely be covered in terms of how we define those covered services. Many times preventative health services in state plan amendments along these lines are defined as services to prevent disease, disability, and other health conditions or their progression, and to prolong life and promote physical, mental health, and efficiency. And then oftentimes beyond that, it spells out health navigation, health education, screening and assessment, chronic disease management. And so the hope would be some of the work that you all do would be covered services. It does have to be referred by a licensed provider that we can spell out in the process. But yes, the hope would be that some of the services you all provide would be covered under this benefit. I'm sorry, just reading through some of the chat.
So Gayla Lobato, who's a case manager at Valleywide, she works in a clinical setting doing navigation and would like more information on Medicaid reimbursement. Perhaps Gayla, can you unmute? Can you tell us what, this is a proposal to actually create that reimbursement mechanism. It doesn't exist right now. And to do that, we need a legislator to put forth a bill in the state legislature, and we need it to pass. And if it passes, then that law would ask Healthcare Policy and Finance to then submit this state plan amendment to the federal government, delineating or describing what are the services that a community health worker or health navigator does and how it will be reimbursed by Medicaid. So doesn't exist right now.
So I have a question. My name is Laura Martinez. I work at Valleywide with these ladies.
Mhm.
And I thought I heard Andrea say that health navigators would have to have some sort of certification. Currently, the majority of my case managers, we call ourselves case managers, are on the patient navigator registry for the state of Colorado. We were fortunate to get funding through PTNC and CCSP to get us on that, obtain the training and get on that registry. Would that suffice?
Yeah, so the hope is to be able to leverage the work that CDPHE in our state has already done as it pertains to they define it as health navigators and the training and registry that they already have put together. Depending on how we define the covered services, we could need some expansion in terms of what that training and registry includes. But the hope is that we're not recreating the wheel from scratch because that work has already been done. We don't want to supplant it. It's meaningful. And so how can we leverage that work to date? And depending what we spell out in that SPA will probably depend or dictate how much we need to expand that pre-existing training that already is there. But the hope, Laura, would be to maintain the voluntary aspect of the training and registry for folks, but that if they do go through that training and registry, it does mean that they meet the minimum qualifications to turn Medicaid billing on.
Perfect.
Yeah.
Thank you.
Yeah. And I popped into the chat if helpful, because I know we're getting into detail on some of these other states who have pursued state plan amendments, what they've spelled out in terms of the covered services, what they've spelled out in terms of the minimum qualification and training, and what that reimbursement looks like, just to give you some examples of, you know, directions that we could go, and that, you know, we do have some pathways that other states have gone down that we can learn from and I think leverage in this opportunity. And I think even if folks who have said they don't work in billing directly, to Patty's point, I think we want to make sure when we're digging into the details of setting up Medicaid reimbursement, to Laura's point, you know, what does the training and certification look like? How do we get folks through that training and certification? How do we educate and make sure that folks know what the covered services are related to community health workers? And I think another conversation, which I don't know how relevant it is to this group, is utilizing the umbrella term community health worker to encompass multiple professionals is where the national kind of nomenclature has been moving. And so that's where our guts are going in terms of going with that movement, streamlining how other states have done it to date. Go ahead, Patty.
So the question to the group is, are you okay if the legislation talks about community health worker, even though we're really talking about health navigation within clinics? But is, you know, are there strong opinions about the title that is used in the legislation?
This is Laura again. I don't see an issue with it. I know that we're all doing the same work, so potato. I think it'll be fine.
I think it might be interesting if those who are navigators or have a navigator team on the call right now could put in the chat what your title is for your role, because there is, I know, a lot of variance in all of those who are on this call.
Also, let us know, do you care what the title is? Because in the legislation, it would, or the state plan amendment, it would say, you know, like community health worker encompassing other position titles. So it, you know, the whole idea is to set up the Medicaid reimbursement mechanism, and your clinic can name the staff whatever they want. It really comes down to what they're doing.
This is Laura again. I think that's fine, again, as long as they do maybe plug in those titles that various agencies are using, so that when it comes down to it, they can, again, as I mentioned, we use case management. So if case management isn't in that verbiage, will it then be covered? So I think if we can get all those titles, I know it's probably a lot. I think that would be fine, personally.
So Amanda said a specific title doesn't make a huge difference. Marissa did ask, will the case manager or navigators be able to enter the billing codes for reimbursements themselves if under a rendering provider?
I believe we're still working through the mechanics of the options in terms of billing, if a CHW would be able to bill themselves, or if it would have to be the provider doing the billing. And so we have a question into our state Medicaid department that I'm happy to circle back, but we're still learning about if that's a possibility on this front. And then I'm just going to pop into the chat. One of the most common definitions we've been seeing is the American Public Health Association. And so I think at the beginning of that, we can plug in community health workers are known as a variety of titles, including health navigators, promotoras, et cetera, and then potentially lead into this lengthier definition is where we've seen a lot of states go.
So should we ask again about the certification, if there are any other concerns? You know, so what Laura brought up and Andrea discussed was, you know, very important, using the existing infrastructure. You know, we already have at least a few training programs around the state. But are there any other concerns that we need to know about or think about in terms of how these CHWs get trained and certified, and in order to be able to bill Medicaid through a provider?
And I'd be curious if any of you have gone through CDPHE's training as well, the registry process, if you have any feedback on that as we evaluate this question. And also, I think in our minds, we want to keep the barrier to entry low in terms of not adding any additional requirements as it relates to education or barriers on that front. And so we want to maintain the voluntary aspect of the certification and registry. And so that's where we're at. But I think, to Patty's point, if anybody has additional feedback or concerns as we think through certification.
Yeah, Andrea, I think for this group, it wasn't really voluntary. I think because the funding is from the state, they were all required. So as Laura mentioned, the people who are doing the navigation at Valleywide were required to go through the training, one of the trainings, and then sit for the assessment.
Yeah, and I know internally at Children's Hospital, our health navigators have to do the same at this point.
So it says, the last one, I don't know who that is. The Alexander said, the title doesn't matter. That person has the title of outreach and enrollment, patient navigator, referral, and authorization. So how to alter, yeah. I'm in the registry for navigation. Okay. So any concerns, things about regarding the training, making training more available, or changes to the registry or the certification? Kind of now's the time.
Or if there's not, if there are aspects that we're not bringing up that we should be aware of, unintended consequences that we're not thinking through, maybe the questions we're not asking. Also, would love to hear anything else as well.
It's like Laura's ready to talk.
Yeah, I fortunately, I don't have a lot of turnover, but on the rare occasion that I do, then it's kind of expensive to go through the training to the Patient Navigation Collaborative. We've been very fortunate that, you know, CCSP has kind of covered that for us, but also the cost to sit on the assessment. can sometimes be a barrier for our organization. So I guess I'm just wondering if there will be additional funding maybe in the future for us to be able to make sure that those people coming on board will be able to become certified and be on that registry.
Yeah, we've been thinking through beyond, this bill and this policy, if we can think through additional targeted funding for the ongoing costs associated with the training and assessment. And so we're very open to that conversation. I think it would probably have to be a separate policy than this bill, but it's something that's come up in all our conversations to date is around the training costs. And I know there's been some federal dollars coming into our state related to getting folks more through the training. I don't know if that will continue down the road, but I think we'll keep an eye and a pulse on the state level and federal level dollars. Patty, I don't know if you have any other insight on the federal movement for training dollars.
So the PNTC, along with Trailhead and the Alliance, which is the statewide coalition for health navigators and community health workers, we just got notice that we received a $3 million federal grant. And so we will have training funds for about 80 new and existing navigators and community health workers over the each year over the next 3 years. So ideally, when you do have turnover, that your staff will be able to receive free training. However, it does include field placement, so internship, and it's more expensive than just the health navigator training. So yeah, I mean, a couple things are coming down the pike. But like Andrea said, we don't know if the federal government is going to institutionalize community health worker training, or if this is a one-time influx of funds. Hopefully, it will embed within the public health training programs that they currently fund. So, so what I'm saying is that there's training money.
Thank you.
So what other questions do you have?
And I think if folks don't have questions today, or I also recognize it's during lunch, I'm happy to put my email in the chat. And if you have more thoughts after the fact, or if you think of other folks who should be involved in this conversation, or you yourself want to stay in touch, we are hopeful to reconvene our policy working group at some point in mid-October with a bill draft. Or if you can't attend those meetings, I have an email list going as well. So I'll pop my email into the chat. And
I was wondering if all of you, if you think this is a good idea to propose legislation to force the state to actually invest in health navigators and community health workers, rather than these, grants that come and go and they're not secure. I mean, could you put use an emoticon, one of those reactions, thumbs up if you think, yes, we need this, thumbs down if you think there's going to be some kind of consequence that, is not good. Just let us know generally what you think. Okay, I see a few. So the rest of you, is this not, it's low priority, or what do you think? Any thoughts?
Some thumbs up in the chat. And then if you have Zoom, if you see
Okay.
the little reaction at the bottom with the smiley face and the plus sign on it, that's how you can do the thumbs up on your screen.
Okay. Yeah, so the reason why I'm asking how important you think this is to your clinic and your job basically is eventually, you know, we will need people to show their support. You know, this is this is the early stages, but you know, the whole idea is to have these sustainable funding for these positions, and Colorado is behind. You know, there's many other states who have already figured this out. So in our state, we kind of figured out the training part, but that doesn't, you know, that doesn't mean your positions are secure, or that we're able, you know, CCSP is going to be funded forever. So this is one way. All right, thank you. Yeah. Yes, there are pros and cons. And so we really want to hear what the cons are, you know, so that we can either minimize them or just be aware. So Nikki, if you have, you know, please reach out to Andrea, let us know what your thoughts are, especially for rural communities, because, you know, the legislators could vote against it because they are worried about the unintended consequences and all of that.
Yeah, and we've been working closely with our rural health centers across the state as well to make sure this is something that they can implement. And I think I also just want to be clear that the legislation is step one. It's really just meant to be an outline for the state Medicaid department to set up the stakeholder process, who has to be at the table, what details they need to spell out by a certain timeline so that we make sure they actually apply for the state plan amendment and get this process rolling. And so there'll be a multitude of ways to get involved, if you review the piece of legislation and you have concerns, would love to continue to hear from you all beyond today. And also just checking the chat again, sorry.
Yeah, step one, but it's the first hurdle to get through.
Yes.
Well, wonderful. If there aren't any other comments, and I think Andrea had mentioned she's been holding like a policy work group meeting every, well, depending on where you're at in the development process, but it's an opportunity to get an update and to provide some input as well. So that's why Andrea asked you to email her if that's something that you, or say your supervisor, I think someone had written that their supervisor should get involved. Please, please consider being involved.
And Wesley, if you don't mind sending out my email whenever you send out an update, just so folks have it. Yeah, again, just step one, but really a continued conversation moving into the future that I know we're excited about. And so just want to make sure that, you know, the pros and cons and consequences that we're all thinking about, make sure that we get it as right as we can. But yeah, thank you all, and thanks for letting us talk.
Thank you very much.
All right, thanks everyone. And I'll send out Andrea's email, and it looks like Elsa and Andy couldn't join today, but if anyone has any additional CCSP questions at the moment, if not, we can end early, and I'll send out the recording and Andrea's email. Does anyone have any last questions or comments? Nope. As always, just feel free to shoot us an email if you do think of something. But yeah, thank you so much for all of your feedback. Thanks for hosting this conversation. And we will get this sent out within the next day or so. Appreciate it.
Thank you.
Thank you.